Hi, my name is Taylor. I am recording this video for my health communications class at the University of North Dakota. The primary purpose of this presentation is to identify a health issue, create a campaign, and a target population. The health issue that I decided to explore is that of postpartum depression. And for me, this hits close to home. I had a personal experience with postpartum depression, so it felt really good to dive into this and start learning a little more statistics that I didn't know several years ago. So part one of my paper addresses my health issue as a whole. According to the CDC, 1 in 5 people have a mental health diagnosis, and following closely behind that statistic is that 1 in 8 mothers are diagnosed with postpartum depression. Being a mom and welcoming a new baby into the world is arguably one of the most incredible things and most exciting and happiest moments of a family or a woman's life. So when a mother is uncontrollably sad or depressed about that situation and about the process, they might feel embarrassed to speak out about what they're experiencing. There is such a large stigma behind mental health in general, so mothers often feel that pressure to not reach out due to the stigma around mental health complications. It's important for women to know that it's okay to get help and to recognize the warning signs of postpartum depression and that it is very common and there is help out there. In the first part of my paper, I do explain the symptoms of baby blues, which are just short-term symptoms of really tiredness, sadness, worry, and those symptoms often go away within a few days. When they pass beyond 2 weeks, or those symptoms seem to become more intense or severe, that is when we creep into the diagnosis of postpartum depression. Baby blues is actually a very common symptom that mothers experience. It happens in roughly 80% of women who have just given birth. So just knowing the difference between that postpartum depression and baby blues will really help get a diagnosis out there for practitioners to help with treatment options. In that second part of my paper, like I said, we were supposed to target a particular population, and mine was women who have just given birth. And only 20% of mothers are asked about depression during prenatal visits. So just knowing about if they have prior mental health complications, it could really help offset any type of complications they might experience afterwards. So, and then also, though my target population is about mothers with mental health complications and with newborn babies, this campaign also could help expecting mothers learn about prevention and early detection. It can help a new mother's spouse or family members recognize warning signs too. And then maybe even saying to the mother, hey, maybe we should speak to a physician about your symptoms. And then it just helps open up that conversation and get them a little more comfortable. So the third part of this paper was theory and research. So I researched the topic of postpartum depression. And the first article that I reviewed explored different theories relating to why some mothers develop postpartum depression and why some don't. 3 theories that they explained in this article was the biological theory, the psychosocial theory, and the evolutionary theory, and then how those theories influence the mother. The biological theory really believes that hormone fluctuations are a driving factor to why mothers experience postpartum depression. So that those hormone fluctuations have a major impact on brain chemistry. And then the psychosocial theory focuses on, how past exposure, societal pressure, and all those types of things emotionally may weigh on a mother. And then lastly, within my theory research was that evolutionary theory in this first article. And that states that any woman could develop postpartum depression regardless of their biological or psychosocial or societal history. That second article I move into explores how talk therapy and selective serotonin reuptake inhibitors, also called SSRIs, can help treat mothers with diagnosed postpartum depression. So talk therapists use techniques such as CBT or cognitive behavioral theory to help overcome the symptoms of postpartum depression. In addition to that, some professionals might recommend trying at those SSRIs, such as Zoloft, and that is one that I have had good success with as well. Just knowing the treatment options that women have too. And then in Article 3, it includes that information that we talked about a little bit before, was just noticing the differences between baby blues, postpartum depression, and postpartum psychosis. And then warning signs to determine the correct diagnosis. Early detection can help prevent symptoms from worsening, and early treatment can actually do the same too. Prevention and treatment definitely have a huge impact on how quickly a mother can recover from postpartum depression. It's important for doctors to get the conversation started early for those reasons, just to help mother recover quicker. So that's why, it's a good thing for mothers to just be aware of these types of things, types of symptoms, just in the case that their own provider does not bring up any of these symptoms or warning signs or anything like that. They can actually bring it to them and say, hey, what if I start experiencing this? What should I do? Or just kind of getting that conversation started early. And then I just really quick wanted to touch on how I described baby blues and postpartum depression. But postpartum psychosis is a more severe mental health complication that can happen. It is very rare, but it's important to note that that is a medical emergency, and that a woman should actually go to the emergency room and seek help immediately. Women can experience hallucinations and hearing audible hallucinations and hearing things that aren't real. And then lastly, in my paper are my campaign messages that I developed. The first campaign message I wanted to get out there was just to create an app where women can kind of share their symptoms, maybe review other people's symptoms, see if they're experiencing the same thing, and then just pack articles in that app where women can do their own research on postpartum depression and all those types of things. And then the other one was a doctor's office flyer that would say 0 to 2, how are you? So 0 would note that there are no symptoms, I'm doing okay. A 1 would be, I'm kind of having symptoms on and off. And then 2 would be, I'm having symptoms every single day. These are pretty severe and they're affecting my mental health. I figured putting those flyers out there in a doctor's office would help the doctor say, oh yeah, I need to, look over mom just as thoroughly as I look over baby. And then mothers too could be like, hey, what's that scale about? And I feel like I'm having some of those symptoms. So I figured those would be a good idea to get my campaign out there. And then just in summary, postpartum depression does not discriminate. It can show up in any woman for a variety of reasons. So getting that conversation started and working on more preventative cares versus trying to catch up once it's already developed could be extremely life-saving to a mother's mental health. In In summary, postpartum depression is a very hard thing to talk about. A lot of women don't like to reach out or explain their symptoms from embarrassment and stigma and all those types of things. But coming from someone who has recovered from that really scary time, it is life-changing when you finally find the care that you deserve and the care that you are entitled to. So thank you for watching my presentation, and I will see you next time.